Hi everybody, Johnny and Paulina here, and we're looking at manual muscle testing of the muscles that invert. So we'll look at this, so that the invert, so bring the sole of the foot towards the midline of the body. Now, the major contributors of this are tibialis posterior and some of your flexor digitorum muscles, okay? So what we do is we get the patient into side lying. So I'm going to test this leg. So if she's lying on her right, we'll test the right leg. If she's lying on her left, we'll test the left leg. This is a no-tech type of testing, and we use the MRC, so the Medical Research Council scale, 0 to 5, 5 being normal strength, 0 being not able to complete the movement at all. So first of all, we want to see if she can actually do the movement. So what we want to do is bring the patient into dorsiflexion, so toes to nose, and a bit of a eversion. So we want to see, now she's going to work against gravity, so can she actually invert the foot? So you can see that the foot is adducted, it's inverted, she's gone into supination. So she's got a 3 out of 5 already on it. So as long as she doesn't report any symptoms, then I'm happy to go ahead with the testing. I use my proximal hand, so my proximal hand is the hand that's closest to the patient's head, and I stabilize the lower aspect of the shank of the leg. Then I get my hand on the midfoot. Okay, so if I go on the calcaneus, some people say that you should be just putting your hand on the calcaneus, but I don't feel you get the level of strength or force that you need to against stronger patients. So I usually go for the midfoot using gravity, and what I'm going to do, my direction of force is going to be in eversion and dorsiflexion, so the opposite to inversion. So I get there, I ask the patient to resist that position, resist, 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 and then I would check that. So she was quite strong on that. I would check that then against the opposite side, and then use the MRC scale. You could use a handheld dynamometer, which has been shown to be valid and reliable if you want some objective numbers on that. I don't have one at the moment, so there you go. All right, I hope you enjoyed the video, guys. That's manual muscle testing for inversion of the talocrural joint or the ankle complex.